I was diagnosed 27 years ago, and I never heard of precision medicine. Tell me why it's important to have precision medicine.
Absolutely. I think that medicine has really advanced a lot in the last 20 or 30 years. The Human Genome Project, where we sequenced all of our DNA, finished in around 2003. And since then, there's just been an explosion of knowledge around how different genetic factors can influence both diagnosis, but then also treatment of cancer and a lot of other conditions. If you're going into a game and you're stepping up to the plate, one of the important things that you want to have is a scouting report on the pitcher that you're going to be facing. Genetics gives us that. It lets us know kind of what might be coming, so that we can kind of anticipate and prevent potential problems that might happen.
So with that being said, how or is the medicine different from almost 30 years ago when I took my chemo intravenously for 2 hours?
Everybody responds to medications a little bit differently, and a lot of times in medicine, it's just sort of trial and error. We give you something and then we see how you do, and some people respond well and some people have terrible side effects. And so if we can predict that ahead of time and know that that's coming, we can do different things. We can adjust the dose, we can give you a different drug, we can provide some more supportive medications to help manage the side effects, so that we can give that patient the best possible chance of getting the best possible outcome from those drugs. The second part is picking the right drug to treat your specific cancer.
Gotcha.
Right? Everybody's cancer is a little bit different. And so if we can target specific drugs to your specific type of cancer, we're gonna have a lot better outcomes than just giving sort of a generic drug that doesn't necessarily have the same effect for you versus a different type of cancer.
Is there or are we still working towards certain foods that can enhance the medicine, or will tell you to stay away from certain medicines? Are you getting that with the research as well?
Yes, there's a ton of research in sort of precision, what we call precision wellness, which is all about how do we get people to have the right diet, the right lifestyle to improve their outcomes. Even for people who have, genetic factors that increase their risk of cancer, it's rarely is it that it's going to be 100%. There's always some sort of component of their environment, their lifestyle, that's going to influence either increase or decrease their risk of cancer. So if we can get people on the right diet, the right exercise, those kinds of things can go a long way to preventing cancer from the get-go. We've been doing genetic testing to guide chemotherapy since around 2019 or 2020. In early October of 2025 is when the FDA started to mandate this testing. And that really didn't change anything for us here at St. Elizabeth, because we've been doing it for the past 6 years.
It's phenomenal what you guys have been able to do in only 5 years, and hopefully the next 50 years will be as gratifying as the 5 years. So congratulations once again.
Yeah, thank you. Appreciate it.